Hi, welcome to Stop, Start, Continue, a reconciliation of the pharmacy industry sponsored by the Medical Memory. Thank you for joining us today. We look forward to providing you with quick thoughts from leaders across pharmacy to improve outcomes for patients. Make sure you follow us on LinkedIn and listen to Stop, Start, Continue wherever you get your podcast right now. In each episode, we're going to talk with top pharmacy thinkers and delve into what they feel needs to stop, what needs to start happening, and what needs to continue as to be best practices from their point of view. You'll hear from industry leaders from all practice sites, from retail to health systems, FQHCs to specialty pharmacy, noted regulatory experts, and patient safety advocates. We'll get their thoughts on what is driving pharmacy forward and what is holding us back from even greater heights. My name is John McMillen. For the past 20 years, I've been supporting pharmacy practice for inpatient, remote retail, specialty pharmacies across different practice settings, health systems, FQHCs, retail independents, and specialty pharmacies. My co-host is Julie from the Medical Memory. It's a video education program that elevates the patient experience, increases medication adherence, and drives better patient outcomes. On this episode of Stop, Start, Continue, we're joined by Dr. Al Carter, Executive Director of the NABP, the National Association of Boards of Pharmacy. Welcome, Al. It's great to see you again. How's the start of fall been for you? Busy, I'm sure.
It's always busy, John, and thank you for having me. I look forward to this conversation, but it's been busy, but it's better than not being busy. Let's put it
That's right. I think the last time we spoke, you were about to jump into a bunch of meetings with different state boards, so I'm sure there's great conversations happening from there. And with that as a jumping off point, what do you see as something that, from your point of view, really we need to stop and put the brakes on and really to improve our practice across, the different sites that we all hit?
I think first, John, as far as stopping, there's a lot of negative press on pharmacists today and pharmacy as we look at working conditions and some of the challenges with workforce shortages that are affecting all healthcare professionals, specifically pharmacists. What that has done, though, is that has led many pharmacists and others to advocate against pharmacy for future pharmacists. So we need to stop telling students, those in college, those getting ready for pharmacy school, to not go into pharmacy school, because it's going to lead to further shortages and further challenges in healthcare that doesn't benefit anyone. What we're dealing with now with working conditions and so many shortages, we're working through to address both the regulation, working with different pharmacy associations, what have you. What we can't address is people telling or saying negative things about pharmacists when pharmacists have stepped up to the plate for COVID, when pharmacists have stepped up to the plate for H1N1, any type of pandemic, epidemic, any opioid use disorders, stepping up to the plate there. Like, pharmacists are always there. It's kind of like, I had a statement that was told to me where it says, pharmacists are like fire extinguishers in an emergency. It says break glass in case of emergency. Yeah. When you need a pharmacist, break glass. And that's what, federal government has done for COVID. That's what we're doing right now to provide access, more accessible access to opioid use disorder treatments and what have you. So stop telling individuals to not go to pharmacy school and not become pharmacists. It is a great profession. It is a great career. I've been doing this for over 20 years, and I love my job. I love what I do. I love advocating for pharmacists. So continue to do so. Stop doing that so we can move forward.
That's a great point, Al. And you're right. There is so much value that the pharmacy and pharmacists bring to patients and communities that they serve, right? I mean, there's people are much more trusting of their pharmacists and pharmacies and see them on a more regular basis than any other part of the healthcare continuum. So it's really important that we keep bringing the new folks into the profession and making sure that they are, providing the same level of customer and patient care that we've all been used to, right? And you're right, this is a great industry to be part of. I'm lucky enough to be part of it, for the past 20 years or so. And so I really appreciate the fact that you're saying, hey, let's remind ourselves what a great profession this is, and bring those folks that really want to help patients and improve their community health, to come on in. It's a great place to be. It's wonderful.
Exactly.
Right.
Exactly.
Awesome. So with that being said, what's one thing that you think we should start doing more of, including advocating for our profession?
And I think that's the most important thing is like we need to educate, and we haven't, there's a lot of pharmacy associations. We've been talking about this. We need to educate the public on what pharmacists do, the capability pharmacists have, what pharmacists can do with that interdisciplinary team in practice in healthcare and providing quality healthcare. And we need to do so not just during emergencies, but all the time. And how do we educate the patient? How do we educate the general public? 95% of the general population live within 3 to 5 miles of a pharmacy. And so the capabilities and access and opportunities to have healthcare and quality healthcare provided to them is at your pharmacy. And many know that, but many more don't.
Yeah.
And so we need to start advocating and promoting pharmacy to the general public and showing just how pharmacists and their pharmacy staff can help and assist in their healthcare needs.
Yeah, it's so interesting that you even say that, because working within a lot of hospitals, medical memory was originated more in surgery centers, doctors, clinical spaces. And it's so interesting leaning more and learning more about it. Every single one of those patients are also touched by pharmacy, touched by beds to meds. And so for some of our hospitals that started leaning into, this is this huge resource, this is what you have available to you. I had no idea, even that capacity. It was like, okay, great. Here's my surgeon. That's all I need. We're done. And I'm discharged.
Yeah.
But being able to have different, tools and resources to even provide these hospitals say, hey, we don't know. Most patients, most of your average person does not know the capacity and what's available. And even a lot of the free education and resources that they can get about, what they're taking, what they're not taking, and all of that. So absolutely. I think that's one thing that even I've noticed and learned a lot from, as far as how often that's being touched in every specialty,
I'd be shocked to hear any doctor, nurse, physician assistant, nurse practitioner that doesn't have a pharmacist that they go to for medical advice, for medication advice. I hear it all the time from physicians. I don't know what I would do without my pharmacist or the pharmacist on my interdisciplinary team. And so, other healthcare professionals know, it's just the general public doesn't necessarily know. So how do we educate them as well? And not just wait till, there's some pandemic or other emergency where it's like, all right, I'm going to go to pharmacist. This is the only thing that's open. Let's see what they can help us with and go from there. A lot of relationships for patients with primary care providers or with other healthcare professionals start from them going to the pharmacist.
Yeah.
And so that's, understanding just the value that they can bring and promoting that is something we need to start and we need to do a better job of.
Right.
Yeah, absolutely right. I mean, it's incredible how much the pharmacy teams in every practice site impact patient care and improve patient outcomes, right? So, and that's what we're all here for, right? The whole group of healthcare professionals is the goal is to make that patient better, right? So get a better outcome, and we're really, the pharmacy is really at the center with the rest of the professionals saying, hey, let's take care of this and get these patients on their way and into a better place for sure. Yep. So we've talked about, stop negative advocacy, start educating the public about, hey, this is really an important part of the team, and let's get away from, kind of the crisis mode of getting the pharmacies involved. So what's one thing that we're doing right now that you think, is a great thing we need to continue and probably do more of?
Pharmacists continue to step up to the plate when asked to do something. So we started off, if you think about it, in H1N1 in 2010, 2011, pharmacists really then, many states started moving to allow pharmacists to provide immunizations. It then started to only adults. With COVID, we've been providing immunizations down to babies, individuals 3 and above. We've also started doing point of care testing. So testing for flu, test and treat for flu, test and treat for strep throat, test and treat for COVID. Pharmacists continue to step up to the plate to do what is necessary to treat that patient. You look at the passage of the MAT Act, so the Mainstream Addiction Treatment Act. So now pharmacists are entering into the space with substance use disorders, opioid use disorders, to provide assistance and to provide treatment there. So we need to continue to show to show our value and continue to do these types of efforts in the healthcare space, because we know that there's huge shortages across the whole healthcare spectrum, and it's going to take a team to be able to provide that quality and patient-specific care to each patient and make sure it's individualized to meet those patients' needs. And so we just got to continue to step up to the plate to provide those services and not shy away from doing those or hesitate from doing them, because we are trained, we are educated, and have the capability to do all those services and provide even more.
Yeah.
Right. That's a great point. And again, we're in our pharmacy, some of us every week, every month at a minimum, right? So we're already there. We've already got, I got my flu shot at my local CVS, right? And it was easy.
I got to get mine.
So it was great, right? And, there's all kinds of those services in a healthcare environment where they're trusted professionals and people know I'm going to get great service there, because, it's easy, again, to do that. And it's a lot easier to get an appointment with the pharmacy than it is with a lot of primary care.
Right. And we shouldn't have to wait until, it gets to a point where patients go into an emergency room, where healthcare costs are, so much higher. It can be done by talking to a pharmacist and when you have symptoms or when you have conditions, because there are many ways that pharmacists can help, and should just continue to step up to the plate to talk to the patient, to educate them on, their conditions and ways that they can help themselves, but then also ways that pharmacists or others can help and providing different services, whether it's a healthcare clinic, screening, whatever the case may be, to provide that service to help that patient live their best life.
Right. That's awesome. Well, I appreciate those insights, Al, and as always, your ability to kind of bring us all to a couple of really good places and help us understand what we can do to stop, start, and continue making our profession better is really, amazing. So thank you again. We appreciate it. That'll wrap up this edition of Stop, Start, Continue. Look for this podcast and a lot of great future guests coming forward. Thank you.
Definitely. Thank you, John. Thank you, Julie. This is great.